Good afternoon. This is Between the Lines at StayTunedSandusky.com. I'm Matt Westerhold, and my guest today is Bryan Hambley. He is the Democratic nominee for Secretary of State, running this November in the general election. Thank you for being on this edition of StayTunedSandusky.com. Brought to you by Serving Our Seniors. All things for everyone who needs attention, medical attention. Go to, not Serving Our Seniors, I'm sorry, Erie County Health Department. It's a new sponsor. Sorry, we're going to get this right. But anyway, this is the new Between the Lines, and I'm here with Bryan Hambley, the Democratic nominee for Secretary of State. You're a doctor.
Yes, I'm a leukemia doctor in Cincinnati.
And what prompted you to become a candidate for Secretary of State?
Gerrymandering in Ohio is the upstream problem that makes our health care worse, our politicians less responsive, and I think we need more honest and fair elections in this state so that people can rely on their government to do what we need it to do.
And we're at the beginning of a new gerrymandering process, or a new redistricting process.
That is exactly right, because we passed partisan maps in 2022.
Mm-hmm.
We are going to have in Ohio congressional redistricting this year. What I want people to know, Ohio is already one of the most gerrymandered states in the country.
Mm-hmm.
We have 10 of our 15 representatives who are Republican, 67%, but only 55% of our voters vote Republican on a regular basis. What we need is districts that are drawn not by politicians, but by an independent commission of non-politicians.
And I kind of know the answer to this, but how can the Secretary of State impact that process?
Yes, what our Secretary of State did in 2024 when we had a
You're
constitutional...
talking about incumbent Frank LaRose.
That's exactly right. What he did in 2024 was when we had a constitutional amendment that would have created an independent commission. He used dishonest ballot language that confused many Ohio voters on what they were actually voting on. Now, I saw this, and many other people saw this in 2024, but now the chair of the Ohio Republican Party has said not far from Sandusky in a public meeting this January that, quote, confusing Ohio voters was a pretty good strategy. Was the whole intention.
And so then how do you reverse the damage that's been done if you're elected Secretary of State?
I believe we need to put the independent commission right back on the ballot in 2027 and to put it on the ballot with fair, clear ballot language, and then let Ohio voters decide what they want.
And that's your number one issue.
That is our number one issue.
Is gerrymandering, redistricting.
That's right.
So you mentioned that Ohio's balance is 10-5?
Yeah.
And that's the congressional balance. And what is the right number? And this is just based on voting trends over the past decade, I think.
Yeah.
What is the right number if it were done?
I think we're a state that should be somewhere around 8 to 7.
8 to 7.
Which is about where we are when we vote. The most important thing for people to know is that these districts don't happen by accident. When Republicans have tried to figure out how to gerrymander our state this fall, what they do with a congressperson like Congressperson Sykes, who represents Akron, is instead of letting Akron be in one single congressional district, what some of the maps they're doing, they split Akron in two. And they divide Akron up so that Akron actually doesn't have a single representative who's a Democrat. Mm-hmm. They have 2 representatives who are Republicans. Mm-hmm. That's how maps destroy us. And I'll say one more thing on the state legislature level. Athens, Ohio, is a town of about 60,000 people. It's a college town. Mm-hmm. It votes Democratic. Athens County votes Democratic. Mm-hmm. Used to have 1 Democratic state rep. What's happened now is they have split Athens County in 2, drawn these crooked little maps, and now Athens County has not 1 Democratic state rep, but 2 Republican state reps. That's what gerrymandering does. That's why it hurts everybody, is because those people in Athens County aren't represented.
Is the party united in this battle against gerrymandering?
Yes.
And what happens right now? We're getting ready to start a redistricting process next month, I believe.
That's right. The party is united, but I'll say more than just the party. Independents don't like gerrymandering either. Mm-hmm. And many people in rural communities who are voting Republican in a lot of cases are frustrated by the cuts to Medicaid that are coming down the pike. And those cuts are happening because those politicians who represent those districts are not responding to the needs in their communities.
Well, in gerrymandering, what is the net result of gerrymandering?
The net result of gerrymandering is that politicians don't think their power comes from their voters. They think it comes from whoever's drawing the maps.
Very good. Another issue that you've laid claim to is ballot initiatives, making those fair. So you're the fairness candidate, is that right?
Yeah, I think that's it. Hey, we'll take that summary. I'll say a lot of people have the memory of going to vote last November, flipping their ballot over, and seeing this 3/4 page of legal mumbo jumbo that they couldn't understand. Many people were frustrated that we had ballot language that was written that way. What I want people to know is it wasn't an accident it was written that way. Our Secretary of State used that confusing ballot language to push people towards voting no on an amendment he didn't like. I do not believe that's how ballot language should be used. Whether it's a conservative or a liberal amendment, there should be honest, clear ballot language so people know what they're voting on in plain English.
So are you surprised that members of the Republican Party, the state leadership, did this?
I'm disappointed that they did this.
And talk about how, you're a doctor, talk about how gerrymandering and the lack of electable leadership or the diminished leadership that results from gerrymandering has impacted hospitals and your profession.
Yeah, I'll tell you, we visited Hocking Valley Community Hospital a couple months ago. And the story at Hocking Valley Community Hospital, when we took a tour with the chief nursing officer and the CEO, is a 25-bed rural hospital. They told me two things. One, Hocking Valley Regional has 3 weeks cash on hand. A hospital in good shape should have 6 months cash on hand. The second thing they said is in the emergency room at Hocking Valley Community, they're 1/3 Medicaid. These Medicaid cuts.
33% of their patients are Medicaid patients, meaning the hospital is reimbursed by Medicaid.
That's right. And if there's a cut to Medicaid, that hospital is going to suffer, and it's going to struggle to keep the doors open. That hospital is a source of good care in Hocking County. It's a source of good jobs in Hocking County. And that state rep, state senator, and congressperson representing Hocking County have all supported these Medicaid cuts. That's what gerrymandering does.
And when you say Medicaid cuts, you're talking about cuts in the One Big Beautiful Bill?
That's exactly right. In the federal budget that would cut more than 400,000 Ohioans from their Medicaid in 2026.
And when you say cut, you're talking about the work order? That people must work to receive Medicaid?
Well, and one thing I want to be clear on is almost everyone on Medicaid works. What this would require is extra bureaucratic red tape that some people wouldn't be able to navigate, and they would then lose their Medicaid. Many of these are children who, of course, aren't working. They should be in school.
And so you have a concern for rural hospitals, among other things.
I grew up on a small family farm, and I know that rural hospitals are an important part of our healthcare system.
And there was I think a $50 billion supplement in the Big Beautiful Bill. Can you talk about that a little bit?
Yep, they've been trying to put this together as a patchwork quilt. Unfortunately, healthcare doesn't work like that. People don't live and go to hospitals only in one place. Many people rely on a network of care. So what we need is not short-term fixes to try to help a small number of hospitals that are at risk of closing. What we need is a systemic approach that provides care to people and a healthcare system that's reliable for every hospital in the country.
And another issue that you're campaigning on is engaging Ohioans in how the government works. Yeah. Talk about that a little bit.
Yeah, I think we have not done a great job of teaching young people the importance of civics, the importance of representative democracy, both at the high school level, but also as they become young adults. Why does government matter to anyone? And talking about how do we build roads? How do we build bridges? How do we make sure schools have enough funding? Not just healthcare policy, but how do we make sure that all of these things we rely on work? And I think the critical thing I want every young person to know is that government does together what none of us can do alone. That, in my view, is the role of government.
And you want to make every vote count. Can you talk about that?
Yeah. If you live in a district where you live in a gerrymandered line where some politician in Columbus decided who was going to win that seat before you ever cast a ballot, you may get to vote, but your vote doesn't count for very much. What I think every vote count means is it should be easy to vote. Nobody should wait in a line more than 20 minutes long. Nobody should drive more than 20 minutes to drop off their ballot at the polling place. Second, I think everyone should live in a district that is drawn by an independent commission so that they can actually be in a competitive race where they can influence their politicians.
And how many IDs should you bring with you to vote?
Yeah, I'll leave it.
I should leave it at that. But I do want to ask you, you grew up on a farm in where?
Southern Indiana, just outside of Louisville, Kentucky. My parents did farmers markets and fruits and vegetables.
And where did you go to school?
I did my medical training at Case Western in Cleveland.
Okay.
And then after finishing training, my wife and I took jobs at the University of Cincinnati.
And how long have you been there?
We've been in Cincinnati since 2020, and we were in Cleveland since 2012.
And your wife's name?
Jana Hambley. She's a trauma surgeon in Cincinnati.
And you have two sons?
A son and a daughter.
And their names?
6 and 8. We try not to use their names on everything.
Gotcha. I do want to ask you, but why would a doctor choose to want to be Secretary of State? Do you have a background in service, or what prompted you to do this?
I've been involved in as a volunteer for many years. That led me to the anti-gerrymandering amendment in 2024, where I organized nurses and doctors to support the anti-gerrymandering amendment. And I saw up close both how important gerrymandering is to good health policy in Ohio, and also how much power our Secretary of State has to keep this gerrymandered system in place. And that's why I'm running for Secretary of State.
Very good. Bryan Hambley, candidate for Secretary of State in Ohio on the general election ballot in November. Thank you for being on Between the Lines, which is brought to you by the Erie County Health Department as a public service. The health department here in Erie County, you might want to stop by and visit them.
Sounds great. It's my pleasure to be with you.
Thank you very much. That's it for this segment of Between the Lines. We'll be back soon with another one. Thank you.